Hi, I'm Doug Short. I'm the CEO of BeniComp Health Solutions, and BeniComp is a company that started in 1962. I've been here for about 4 decades, and one of our strategic partners is Pan-American Life, and JJ is the head of the division that we are a part of. And today I get the chance to interview JJ a little bit and talk about what it is that we do, where we are, what we are with Pan-American, and how that all comes together. Thanks for being here, JJ. Thanks for being a part.
It's great being here.
Inside of Pan-American, BeniComp is a part of a program manager space. And that program manager, we manage and underwrite and pay claims on portfolios. Explain that a little bit and how we do that for you and why.
Sure. So Pan-American and BeniComp has worked together since 2007, and Pan-American has a portfolio of supplemental accident and health products. BeniComp acts as both an underwriter and an administrator for us for some of those supplemental health products. And really what they do for us is very unique in the market. They offer plans that really have no other similar types of plans that are offered out there.
JJ, other things that I think about are the IncentiCare product and how unique in the market space IncentiCare is. Can you speak to that a bit?
Sure. IncentiCare is absolutely unique. So wellness programs are a dime a dozen, but rarely do they actually move the needle. A large part of the problem is participation, right? Typically the insureds that would most benefit from these programs are the least likely to participate. But BeniComp's done a really great, they've done a really great job with kind of flipping that on its head. They brought really effective benefits to the member, and the result has been unhurried participation. They've coupled that with effective health coaching, which in turn, it impacts the overall health of the members and the performance of the plan.
And I think about how knowing the data, or knowing the lifestyle or the dynamics that are controlling the aggregate, knowing that is only half of the story. Doing something about it is another.
Right.
Yeah. So inside of the other program that we work with you that has to do with the stop loss and the largeness of a full medical claim, we call it PHM, Predictive Health Management. That is the expansion of the historical disease management, claim management, utilization management, DMCM-UM. And that is based on a claim that actually happens.
Correct. Right.
Something that the cow's out of the barn. Now I'm managing my expense of that loss. And PHM actually brings forward knowledge about predictions to a loss. Can you speak to that a bit?
Sure, and so what you had talked about, cost containment programs, it's absolutely a great thing to do, and what good administrators should do once there is a claim, making sure that quality, appropriate care, affordable care, is being utilized to affect the outcome. But the holy grail is really kind of what you talked about. How do you get ahead of the claim? How do you either avoid the claim or catch it when it's still a lower cost, and you're able to to improve the overall results from the beginning as opposed to on the back end. And that's really what IncentiCare is, and BeniComp has been focused on.
And then the last thing I think about is that there's a phrase that we like to coin in BeniComp, that there is no cheaper claim than an avoided claim.
That's true. That's true.
So if we can avoid the claim altogether and get in front of it, that's the cheapest. Our clinical director was saying how from a cardiac or cancer, those are the 2 largest claims that you can get ahead of. But actually all chronic illness, the majority of chronic illness, about 80% of it, is driven by things that I can know, like lifestyles. You and I were talking at breakfast a little bit about the PHM space, the ability that BeniComp has to manage claims, which is different than paying claims.
Absolutely.
Yeah, talk about that just a little bit.
It's very unique. So many administrators out there, they are very transactional. They will pay claims, but they're not really set up or organized to impact the overall health and cost containment. So, there's cost containment, but that is, once there's an actual claim, to help contain the cost and keep it under control, which is I think what most entities focus on, and it's a good thing to do, but very rarely have we ever seen an entity that tries to get in front of the claims and actually impact what the member's health, and then in before that claim either happens, or make sure that the intensity of the claim is reduced because it's caught early, and they bring those interventions. And then in addition to that, at the end of the day, the result will be the employer plan becomes
lower
cost and more affordable.
It's interesting as we're talking about that, what BeniComp likes to feel is that we're impacting what's causing the claim, the cause of the claim. And what most administrators want to do is just impact the cost of the claim. And we see that as dramatically different in the market space. Another thought that I have centers around the strength or the value that a consumer has of having your name, your brand on their contract. It's not a banking arrangement. It's not a mathematical arrangement. It is a policy. And what does that mean?
That means the full strength and reputation of Pan-American stands behind this policy. I mean, we're an A-rated 114-year-old company in 22 different countries throughout the Americas and the Caribbean, and we put our reputation behind this. We're confident. This is not a new product. We've offered it since 2007. It's stood the test of time, and it's been approved by multiple states for sale within their state.
So we don't have any reason for an employer to question the strength and stability of anything that's got your name on it.
Correct.
Because you would put your name on it if there was a question about it.
Absolutely.